at one time the CEO of the National Council for Persons with Disabilities. He knows that I'm here. And he sent me very warm greetings because he said Isiolo is the cradle land for NONDO. Because I think you've done so much here. And I just said that I wish to be here, but because of so many competing priorities, we will not manage. Now, allow me to say that in Isiolo we have got 3 projects currently. This is one of them. We have another one being launched today through the CSG mechanism by FASIDA, focusing on issues of emergency response. And again, we have another one which was launched some time back on medical assessments and registration for persons with disabilities. So it means Isiolo, we're still coming. So should be prepared for more of similar initiatives. I also know that we have a sister CBM organization called CBM Global, Disability Inclusion, who again have, I think, an iHealth project here through the AIC Health Ministries, supporting some screening and treatment of iHealth. Having said this, I also want to say that I'm at home. These are accounts that gave me the foundation into the NGO world. When I first landed in Isiolo, I didn't know the destination. I'd just been hired by AMREF, a very young man, full of energy, full of adventure. Then I was told, you have been assigned to Isiolo by them to score the district hospital, the Cardinal County Referral Hospital. Then I went to Isiolo, I took a bus. The journey was a bit long because I didn't know my destination. Then finally, I was told, now you have arrived. And the first thing I saw was Transit Hotel. So I went there and secured some accommodation. After 1 week, I wanted somewhere I can call my own house. There was no better place than a shop, right close to the Transit Hotel. So I told the owner of the shop to make sure the front door is not open. So I went through the back door and I bought a mattress, a blanket, a sheet. Those who know how you settle in a new place. A jacket for water, of course, and some 2 plates, a spoon, a sieve, and all that. Then I spread myself on the floor. And I enjoyed staying in Isiolo. The following day, I wanted to know where my workstation is. So I went to the district. I just walked through the town. People were so welcoming and supportive. I went through the office of the medical superintendent, the medical self-health, MO was there, that's Dr. Taya. And then I was now shown my desk under the comprehensive care unit. That's where I worked for so many years. And I used to have my meetings under the trees near the open field for Wajadi. That's where I used to do my meetings. There's so many groups here. I used to do a lot of home visits. So in Isiolo, I'm simply coming back home. And I'm happy that you gave me a better foundation, and now we can do much more together. So I was talking to the CEC here for help, and I was asking the question around rehabilitation services, because as you know, it's a very small entry point into the life of a person with disability, which begins with assessment, then registration. Then after that, now you are supported appropriately, either by accessing assistive device, either by being enrolled in the cash transfer programs, and even a child either by getting even the scholarships through the National Council, and so many other support that comes through that gateway. So my good people, I'm very happy to be back here, and I'm hoping that we can do much more together, because I felt like we have owned this project by now. The things I always observe when sitting there is about ownership. Because there's no way you can work for the county without the county. There's no way you can work for persons with disabilities without them taking a lead and driving the whole agenda. There's no way you can work for the community without allowing them to own and participate. Because in so many cases, we in our programs, we focus on empowerment and strengthening systems, so that when money ends, access to services, information, education, income, name them, does not end with us. I also want to say that under CBM, we focus basically on working through partnerships, be it national government, county governments, local actors, communities, and the main objective is to improve the quality of life for persons with disabilities across all domains. The founder initially focused for those who had visual impairment, and that's why the blind comes in. But the mission was bigger than focusing on one impairment. So we focus on all domains of disability. And by doing this, we address barriers that either create restrictions for participation or either bring about difficulties in the functioning of various components when it comes to disability. For example, I'm happy this facility has a ramp, but if they had no ramp, it means my good friend Hussein cannot reach here the podium. So meaning we're excluding him from accessing the podium, and you have to take the microphone for him wherever he is. Another one, I know my sister here from, I think that was social development. When you are reading through the script, you said you're struggling to read. So meaning, if we give you glasses, and then they increase the font, now you can read like any other person. Also, my friend here, Abel, is now enjoying the service through sign language interpretation. Meaning, if Elizabeth is not there, then we shall just be talking, but for Abel, he's getting nothing. So there's much more on barriers than the disability itself. And that is very important for all of us, to work collectively, to address the barriers in our environment. So to make sure, if you're doing construction, Madam C is your chief guest. Those who approve the bill of quantities, those who approve the plans, the structural engineering and all that, they must make sure every building is accessible. Natural lighting, a ramp, wide doors, lowered sockets, because I'm sure if you are to set, for example, my good friend said, to look that window, where the handle is, you may struggle. But if you lower a little bit, you can enjoy even that space. Also, we need to ensure that all children are assessed and placed appropriately. And I was happy to hear that you have an ear officer here. That's very important. That's the entry point into the child's life. And it's very important that all these children are assessed and receive appropriate support. Now, the challenge at times we go through is that children who are assessed, especially in Isiolo and other counties, they don't have birth certificates. And now you are wondering, National Council is here. The way the child put it, they want to upload, but now there's no birth certificate. So meaning this child will go home without the certificate from the National Council. And I'm also told some others here do not have ID cards. I don't know what happened. Kindly ensure all the children have birth certificates. Ensure all the others have ID cards. So that when you do the assessments, they can also enjoy the uploading and get the certificates immediately. Now I remember when the CIS was talking about what we can do better through this project. He talked about so many areas, and I just want to repeat some of them. As a county, we have the Disability Act 2025, which is brand new. Then also we have the Disability Policy 2024. As a county, I'm not sure whether you have your own subnational policy, a subnational legislation on disability. Because this is the next step that now you have to bring it from the national level to the county level. And if you have one, you have to revise it to align with the new provisions in the new act. The other thing you have to do is to ensure that you have a disability committee there. In Isiolo you have a committee. But now the challenge is, how representative is that committee across other committees? Because sometimes when it's only us meeting, then kila wakati tulikuwa nasema enda kwa committee yenu, ndio ile wanakutana kesho. But you want, when there's a discussion, it's a budgeting process, it's a development of the CIDP, we have a representation of persons with disability on that table. I'm not sure about the county assembly, how it is. I'm not sure about the, what I call the executives of the county. If also you have the 5% inclusion, but it's very important that you start looking at this act and start complying in good time. The other issues around the aspect of employment. I know my friend talked about issues of AGFO, I don't want to repeat on that. But I'm told some counties are still slightly below 5%, and some are already moving towards the 5%. But I think as our counties work together, I'm happy that we can support you to achieve that 5% inclusivity. Recently I read about the, more or less like an executive order from the CS, Public Service, now directing all MDS, government ministries, directors of agencies, to comply with the 5%. So meaning, we rather start working towards that, because time will catch up with us. And I think at the time of auditing on an annual basis, I'd really be so happy to hear that Isiolo County is leading from the front. The last one I also wanted to mention is about the SHA. I'm hoping all of us here have registered with SHA. Who has not registered, please just be bold enough and say I want to register with SHA. Have we registered? SHA is working for your information. And I think the more you get into the SHA process, the better for you. Because within SHA, it will cover quite a number of the things that you support on rehabilitation. There are even assistive devices that you get when you have SHA. They'll pay some of the bills they've been carrying. So, and by doing that, they can lower out-of-pocket expense that you incur. So I really appreciate that all our people in Isiolo County, and the ones who we assess and register, kindly ensure that you register on SHA. Because you may not have the money to pay for your services, but through the government contributions, we are able to access the services as required. Having said this, Madam Chief Guest, I'm really happy. We're just having a chat there, and I realized there's so much that now we can achieve. Because the Chief Guest is covering 3 areas, and that's the most important, I can assure you. The Chief Guest is in charge of health. In health, it's the gateway to your well-being. My health, my wealth. She'll take care of that. The Chief Guest is also in charge of finance. The Chief Guest is also in charge of economic planning. To be honest, what else do you require? So we have one-stop shop here that we can tap into and we get everything that we want. And I'm sure our Chief Guest will convey this message to the government, because by the end of the day, when we come back and we're now celebrating the milestones out of this project, I'm very happy and excited that I showcase Isiolo as a model county on how to mainstream disability and how to ensure that we can achieve the implementation of the Disability Act 2025 and the Policy 2024. So thank you so much, and now it's my humble duty and honor to invite our Chief Guest. Natendele makofi ya nyaya ya zamani kabisa. Kama tumesahau kufundisha. Mpaka fika 1, 2, 3, funga, fungua. Thank you.
Director, CBM, Benito, and the team, our gender commission team, national government and county government staff who are here, our stakeholders, ladies and gentlemen. Good afternoon.
Good afternoon.
Once again, I am Musi Kaburu, the CC